It's Ralston Live.
Let me ask about a couple of healthcare issues, because as a doctor I know you're very interested in them. There's a move afoot, as you know, in Congress to defund Planned Parenthood. You've probably seen some of these videos, but you also know something about Planned Parenthood. There's two arguments here. One is, if they are actually really selling body parts for profit, that has not been proven, but that's implied in some of the videos, then maybe they should be defunded. Another argument, though, is that abortion is not all that Planned Parenthood does, that they provide essential services for women as well. Should the federal government, should Congress act to defund Planned Parenthood because of what's on those? I assume you've seen some of these videos.
I have seen some of the videos.
So what do you think should happen?
Well, I believe that when people act inappropriately, when they abuse women, their own patients, they should be defunded.
That's what's going on? They're abusing their own patients?
Yes, because, John, as a physician, I understand this more than the other people that are in this race. You know, when you choose to have someone extract a fetus so that they can have complete body parts, that's a different kind of procedure than when you, and I don't want to gross out your listeners, but the hole that you make to be able to extract something in pieces versus extracting it whole, that's a very different procedure. So are you informing the patient that you're going to do a different procedure, a riskier procedure for her in the long term? Are you really getting informed consent? If you are not, then you should not be receiving federal funds for the well-being of patients.
So you'd support the defunding of Planned Parenthood?
I would, because there are so many other people that would take care of these patients.
Really? Are there that many that provide these services out there in the community?
There are people that provide
rural areas that depend on Planned Parenthood? No?
Rural areas that depend on Planned Parenthood, frankly, I guess I'd have to look at a map. I don't know that they're in rural areas that somebody else would not be.
So you think somebody else could just pick up the services?
I think other agencies, perhaps other programs, perhaps other physicians could pick up. Yes, absolutely. We cannot reward people who do not have patients' best interests, women's best interests at heart.
The other issue I want to talk about, and you've talked about this before, you talked about it in your last campaign.